Good morning, everybody, and a warm welcome on behalf of the full board of the University Medical Center to the beautiful city of Groningen and our beautiful hospital and beautiful university. So it's quite, I do open more symposia in this room, but it's quite interesting actually to open a symposium that if I wouldn't have this job, I could have been in the room. Because this is a topic very dear to my heart. Been working many years trying to build AI models for prediction and realized that actually the bottleneck in making impact with these models is access to data. And this is what you are going to be talking about today. In my dream, in the next years, and we'll be leading this, I hope, from the Netherlands, we will be building an infrastructure which allows us to really build a learning health system and a learning healthcare system. The idea, the dot on the horizon, that is in principle we would like to learn from every patient encounter, from all the data that you could collect yourself in order to be proactive on maintaining your health, building resilience, and finding the most appropriate treatment in case you go to the hospital. And there's a lot of promise. There's a lot of possibilities. The way we can utilize data once we have them to build better models because of AI is enormous. But the bottleneck is access to data for many, many years. Also, if we look, now I take the perspective from regionally here in the University Medical Center Groningen, our vision, our motto is more healthy years for everybody. We put in everybody because there's also such a difference in health between people. Even here in the north, just 10, 20 kilometers apart, zip code best predicts your health status, the age that people on average get their first chronic disease, and even the age at which people on average die, which is in a way almost hard to accept that that's still the case. These differences are so large. We believe in more healthy years for everybody and that there's a number of game changers that can bring more healthy years for everybody. And good access to data and utilize the data to learn from, to get new insights, to inform policies, but also to help people proactively keep their health or making more precise medicine is essential. We also hope in 2 weeks to learn that also Europe is going to fund the AI factory in Groningen. And it's very nice, we discussed this morning with a number of people, it's actually in a factory which used to be a tobacco factory, should turn into an AI expertise center where we will build models that are going to be part of this learning health system. So where we used to produce tobacco, we're now going to produce more healthy years. I think it's very symbolic. In a few weeks, you'll definitely, I hope you will read in the newspaper that this AI factory will come. But this AI factory, once it's there, it's just a compute facility. It only becomes useful and only going to have impact in society if we can bring data to this factory to build models that have actual value. And it is only going to work if we have fair data. At the moment, digitalization in this hospital is still very poor. It's very difficult to reuse data. There are all kinds of bottlenecks. Health.ai also present. Luckily, we have a lot of efforts nationally to address this. But there's legal obstacles. There's obstacles in all kinds of differences in formats, etc. And it's very good that today a number of very expert speakers on different topics are going to share their vision. And I hope that there is a lot of interactions that are going to help us building this data ecosystem in which we can connect these data, for example, to infrastructures as the AI factory to really make the next generation of tools that make this learning health system and this learning healthcare system a possibility. So mainly, I would like to first compliment the organizers, Avi and her team, the Digital Competence Center. We're very proud of all the activities going on here, but not only the regional activities, we're very well aligned with all the activities elsewhere in the Netherlands with Health.ai. With that, we also very well connect to developments on the European scale. I think we have the wind in the sail. The European health data space and all that will come from it will help us easier to implement the steps that we need to these learning health systems. But I'm sure you're going to learn more about those today and contribute to the discussions. So I wish you a very nice day today, but also a lot of pleasure in all the work you do, because it's very important, all your work towards building this learning health system together. Thank you.
Building a learning health system together. Yeah, thank you so much.